Hey, I'm Morgan. I'm going to be your student nurse today. Want some hand hygiene. Alright, can you state your name, first and last, and your date of birth?
It's Lauren Pierce, 1101-2000.
Okay. And do you know the president?
Biden.
Okay, and what's today's date?
September 15th, 2022.
Alright, so by that I know that you're alert and oriented ×3. Do you have any pain or allergies?
No.
No? Okay. And you're here for a physical assessment, is that right? Have you ever had one before?
No.
No? Okay. Alright, so they've already recorded your vital signs, so we don't have to start with that. And I noticed that when you walked in, your posture was erect and your gait was steady. You are calm and cooperative, and while we're talking, you're not slurring any words. Your speech is clear, so that's good. Now we're going to start with your face. I noticed that your hair is well kept, well groomed. You're dressed appropriately for the weather. Your face is symmetrical. Your head's almost cephalic, so that's good. Your skin is intact. Can I touch you?
Mm-hmm.
Okay. Right, and your skin is warm, dry. I don't see any lesions or anything. Your skin is appropriate for your age and ethnicity, so that's good. Now I'm going to assess your eyes. You can just look at me. Okay. Okay. And then we'll get you to look at this. I'm going to take it to your nose and you just look at it. Okay, and then look at it. I'm going to do it this way. Just follow it. Okay, so I assessed Perla. Your pupils are equal, round, reactive to light, and the accommodation's normal. I can tell that they are equal bilaterally. Your conjunctiva is pink, your sclera is white, your cornea is clear. So that's good. Take a look at your nose. Look up for me. Okay, I don't notice any redness or anything. You don't have a deviated septum, no lesions or anything. They are bilaterally symmetrical. Okay, can I get you to blow out and then do the other side? Okay, so your nares are patent. Your airway is clear. So now I'm also going to look inside your mouth. You open up. Say ah. Okay. So your oral mucosa is pink and moist. Your teeth are intact, and I didn't see any lesions or ulcers or anything, so that's good. Your lips are pink, so that's good too. Okay, so now I'm gonna take a look at your ears. See if you get any pain, any tenderness.
No.
Okay, I don't see any redness, lesions, or anything. Good on that, and they're symmetrical with your face. Okay, so now I'm going to take a look at your neck. Just look up for me. Okay, your skin is intact. It's the appropriate color for your age and ethnicity. I don't see any lesions or anything, any scarring, bruising. Your trachea is midline. Okay, now I'm going to listen. I'm going to feel for your pulse, carotid pulse. Okay. Okay, so those are equal bilaterally. I give it a +2, which is regular. All right, now I'm going to listen for a bruit. So I'm going to get you to just breathe in and keep it in. And I'm going to listen to it with the bell of my stethoscope. Okay. Okay, and then breathe out for me. And then one more time. Okay, so no carotid bruit noted, which is good. I don't see any jugular vein distension, any JVD noted. So that's good. For privacy reasons, she's not gonna take her shirt off, but I would make sure her skin is appropriate for her age and ethnicity on her chest. I would look for lesions or any bruising or scarring. Also, she's warm, so that's good. So now I'm going to listen to your heart. I'm going to listen to it in 5 places. So I'm going to start here, which is going to be your aortic, and that's going to be your on the right sternal border, the second intercostal space. Moving over here is going to be your pulmonic in the second intercostal space, left sternal border. Moving down, I'm gonna do your herbs point. It's gonna be about right there. That's gonna be your third intercostal space, left sternal border. Moving down a little bit more is gonna be your tricuspid, and that's gonna be left sternal border, fourth intercostal space. Right about right here is your mitral, and that's gonna be midclavicular line, fifth intercostal space, okay? And then I will assess that for 1 minute for your apical pulse. So I got 82 beats per minute, so that's within the normal range, so that's good. I'm also going to listen for some lung sounds, okay? But also with your heart, I heard S1 and S2 sounds. I didn't hear any murmurs, clicks, any gallops, anything like that. So that's good. So now I'm gonna listen to your lungs. And each time I move the stethoscope, just breathe in and out for me, okay? Okay. So your anterior lung sounds and all lobes equal bilaterally. Everything was clear. I didn't hear any avitition sounds. No crackles, wheezes, anything like that. So now I'm going to get you to turn around. I'm going to do the posterior lung sounds and just do the same thing you did for me up front. Okay, so all posterior lobes were equal and bilaterally. Just like the front, I didn't hear any avitition sounds, no crackles, wheezes, or anything like that, okay? Normally I would auscultate on your direct skin for that, but since for privacy reasons, you know, we kept your shirt on. So now I'm gonna get you to lay down for me. Okay, I'm gonna assess your abdomen. So just by looking at it, your abdomen is contour, it's not distended, it's flat, it's your skin color is intact. Your skin is intact and your skin color is well appropriate for your age and ethnicity. I don't see any lesions, any redness, nothing like that, okay? So I'm gonna listen. The first thing I'm gonna listen for I'm gonna listen for your vowel sounds starting at the right lower, go into the left lower quadrant, and then I'm also gonna listen for a brewy right about right here, okay? Okay, so with your vowel sounds, they were active in all 4 quadrants. I didn't hear any abnormality sounds. And then with the brewy, I didn't hear any brewy, so that's good. I'm just gonna palpate. Let me know if you feel any tenderness or any pain. Okay. All right, and for privacy reasons, I'm not gonna get your femoral artery, your pulse, but I would do it about right here, and normally it would be bilaterally equal, regular plus 2, okay? I'm also gonna check for your skin on your legs is intact. I don't see any lesions or redness or anything, no edema, so that's good. Your skin color is appropriate even throughout. I'm going to check capillary fill on your toes. Okay, so it's equal bilaterally and it's less than 3 seconds, so that's good. I'm going to check your pulse, dorsalis pedis. Okay, it's even bilaterally plus 2 and regular. Okay, and your posterior tibial is plus 2, bilaterally equal and regular. So that's good. Okay, and then now I'm going to move on to your arms, so you can get up for me. Also with the feet, if I were to do a clonus test, I would have you lay back down, push your foot back, and let it come back to regular. If it didn't come back to regular and was shaky, that would be a positive, and we would further assess that. But and regular, it would just go back to normal, which would be a negative test. Okay, so let me check your arms. So I see that your skin is intact. I'm not seeing any lesions, any bruising, scarring. Your color is appropriate for age and ethnicity. So I'm gonna check your brachial pulse. Okay, that's plus 2 regular bilaterally. Move down to your radial. Okay, it's also bilaterally even, plus 2 and regular. So let me see your hands. Check for cap refill. Okay, those are less than 3 seconds, so that's good. Hands are intact. Okay. Now we're going to do some range of motion. So I'm gonna get you to take your arm. You can stand up for me. Just raise your arms up for me. Put them down here, circular motion. Okay, put some resistance on you. Okay, so with that resistance, I rate that a plus 5. It's good muscle strength. Your arm range of motion is normal. I'd give it a plus 3 because there wasn't any resistance. Let me see your hands. Can you grip them for me? Okay, and then do your hands like this. Okay, so wrist range of motion is good, and your grasp was good, plus 5. Okay, also gonna get you to do out your leg, okay, and you put it towards me, okay, and then do your foot up and then back towards you, okay, and then with the other foot, other leg, lift it up, lift it towards me, and then put your foot down and then back up, okay, and then I'll get you to bend down for me and touch your toes, okay, so your hip range of motion and your legs and your feet are all normal. Give it a +3, no resistance. That's strong and normal. And then I'm going to get you to, I'm going to touch you. I'm going to get you to close your eyes. And I'm going to touch you. And you tell me which extremity that I'm touching, okay?
Left arm.
Okay.
Right leg.
Okay, so your sensation is good throughout all 4 extremities. All right, so now I'm going to go document and maintain HIPAA. But before I do that, I'm gonna make sure your bed is lowered and locked. You're in a safe position. Side rails up ×2, and your call light is within reach. Okay, do you need anything else? Do you have any questions?
No.
All right, well, thank you.
Thank you.